I have had an amazing experience talking to some amazing people about clinical research. Clinical research is a part of all of our lives. Let's talk about it. What do you know about clinical research? Or
Well,
have,
I was just listening to the young lady. I didn't get her name.
Renee?
Renee, that's who
Okay.
was talking to
Oh,
me.
Nisha. Nisha on the other side.
Nisha.
Yes. Uh huh.
I just found out she's from Atlanta also.
Oh, you're from Atlanta.
I am.
Oh, nice.
And
I lived there for 3 years.
okay. And so I was just telling her that I am on the board for a community center in South DeKalb. And that's a community
On
of
the east side.
right
Yeah.
of low income people who are usually left out of services and initiatives like this. We are in the process now of developing a revitalization plan for our campus, for our work.
Okay.
And we would like to bring healthcare to our campus. And because a lot of the clients that come to our community center, they number one, they're not participating in healthcare services, and they don't have, or they can't afford healthcare services.
Oh, that is fantastic. So first of all, let me just say thank you, and I applaud you for all the work that
Absolutely.
you're doing already, because it is so necessary. And just one of us or two of us can't do it.
Right.
Oh, we have to keep going until we make the impact, because there's resistance.
It is.
And for some of it is for good reason.
Right.
And that's the thing that we don't try to avoid that with Care Access. We realize some egregious things have happened in clinical research environment historically, and hopefully we are changing that landscape so individuals can start beginning that trust journey. And with people like you and these types of partnerships, that's what makes it so important.
The root cause of their circumstances comes down to just basic needs and not having basic needs met. And healthcare is a large factor of that. But then when individuals from communities, and it's not just in the South DeKalb community, but like as you said, it's in a lot of low-income communities where there's a lack of public transportation services to get them to places where they could get services, but the data is not being collected in order to identify where these gaps are, where there are voids, and how they can be overcome.
Yeah.
And I believe that the work that we're doing in that South DeKalb community could form a partnership that would provide the data to help us to identify necessary services to correct what is going on currently in these low-income communities, but more importantly, to give the data to researchers to find out what the issues are.
Right.
And there are some stereotypes where if you have a community of color, their needs are not so much that it's high blood pressure or diabetes. It's just a basic lack of services.
Oh, wow.
Is what it really boils down to. These other issues are secondary.
Yes, or
They're not primary. They are secondary. But as a general public, we're focusing on these secondary issues because they're the larger issues. But that's not the root cause in our communities. And that data needs to be collected so that the primary issues can be addressed before they escalate.
exactly.
to the
So we're
secondary
talking
issue.
symptoms and root causes and things
Absolutely.
like that. Yeah. So are you working with any entities? Like, quite honestly, I would have approached the CDC and said, listen, we need to talk, because I know you do research. I know you collect data. Here's a prime example, and we're right here next to you, and our people are
Absolutely.
primed and ready. Come help us. Have you approached it in that manner? I'm
We
curious.
have not. What we've been doing for the past year is we've been doing a self-analysis, and that's where we've come in to realize that we've been doing great work for 20 years, but it's not changing the community and the people that we serve. And so we're restructuring ourselves, and that restructuring includes bringing additional services to the community, like healthcare.
I see.
So that when folks encounter and are engaged with us, that we can refer them to local services and not just put a Band-Aid
Right.
on a circumstance, because they're going to revolve, and we're going to see them again. That in order to bring about real change then we've got to elevate what we're doing, and that is bringing in services to be located in the immediate community that we're serving, and healthcare is a big component of that. We've had several initiatives where we've sponsored events where you can come in for different types of screenings.
Oh, great! Mm-hmm.
And the response was overwhelming.
Oh.
So we know from those initiatives that we've done that the need is there and the response is going to be there as well. That's why we need to elevate, because what happens in a lot of cases is that you provide an initiative such as a screening where you provide information, but the individuals leave and nothing comes of it.
Yes,
right?
yes.
So you made them aware, like, you're in a bad situation, but then there's nothing.
Yes.
There aren't resources available to help do something about the bad situation that they're in. So the screenings have been good, but
then what?
But then what?
How ready do you think the individuals in the community and your campus that you're referring to is for that, or what it would take, or if they would continue to listen to you if you brought up the words clinical and research in the same sentence?
Absolutely. Well, I think it goes back to something that you said earlier, and that is, we've been in the community now for 20 plus years. So we see ourselves as a trusted resource. And so if it is offered or connected to what we've been doing, then they come to us where there's already trust established.
Yes.
And I think that's the difference in bringing something like a resource like this to a community. Is if you go in by yourselves and set up shop, there's no trusted relationship already established.
Yes.
But if you go through an organization like ourselves and partner where there are already trusted relationships, then it's nothing new to them. It's something that they already trust. And I know based on offerings and initiatives that we've already done that trusted relationship is developed and is mature. It's already there. And so now by having a partnership like this, it's just allow both sides to do a better job. We can provide a better service, and then you can come in and do what you do best. And
Awesome.
And then here's another piece that I think is so important that we can help with as well. A lot of times people in these type of communities don't fully understand the influence that they can have on the larger society.
So true.
They is that syndrome where you don't think your vote or your participation is going to make a difference and it's going to make a change.
And some of that is by design.
Some of that is actually, I agree.
Yeah.
Some of that's by design, but one of the things that I think would be most helpful is where you not only do you have that trusted relationship, but where you can get full participation, is for them to understand by them participating in a clinical trial how that participation could bring about change not only in this local community or even in this country, but in the world.
Yes.
And that empowers that individual and provides that dignity to that individual to where my participation could bring about a change.
Yes.
And that's not something that they have today.
So we need to talk about it.
Absolutely.
We need to educate on
Absolutely.
it. We need to take the steps that say, okay, so you do have a voice. Your voice matters. We can hear you. The greater world can hear you. So allow us to come and start those baseline conversations with those individuals that you already trust. You already have a relationship with. This is not just transactional. We're not just trying to come in, get something from you, and then leave, because we understand that has taken place too many times before.
Absolutely.
So allow us to come and spend some time with you, and then we'll build from there.
Right.
Yeah. So how can we make that happen?
Let's start the conversation.
Okay.
Let's introduce you to the leadership of our organization, and let's move forward. But at the same time, there's some infrastructure that we need to make sure that we put in place.
Of course, always.
And that process has already started.
Oh my
And
goodness.
we're having a fast traction by working with our elected officials at the county level, and even at the state level, and now even at the federal level, where we're bringing in our congressional leaders and our U.S. senators to be part of the effort. And that's going to happen in the very near future.
So you have laid this foundation.
Absolutely.
You've gotten the next level. So we're already maybe to the second floor, and we
We're
just
ready.
need to make this skyscraper just continue into the skies and allow the community to be built from there.
Yes, indeed.
Let's exchange information so that we can do this thing. Yeah,
let's make
we
it
need to
happen.
have more conversation for
Absolutely.
sure.
Absolutely.
So, okay, very good. Well, I so appreciate you taking this time. I'm
Thank you.
so appreciative of the work that you do.